to be back in the gym with you, bro.
Yeah, man, it's been a while.
I missed you when you were in Africa.
Yeah, man.
I meant to ask you, how was your trip to Liberia?
Liberia was good, man. Got a lot done, helped a lot of people. Achoo!
Oh my gosh!
This young man just got Ebola. We're going to teach you today how to avoid getting Ebola.
Hi, we are third semester nursing students from Joaquin Delta College. We're doing a short video for educational purposes on Ebola. In 2014, there has been a recent outbreak of Ebola affecting the regions of Africa, and somehow has progressed into the United States. This video is to provide you with basic information on how to prepare yourself and any other healthcare workers on the Ebola outbreak.
Ebola include fever, severe headache, muscle pain, weakness, fatigue, diarrhea, vomiting, abdominal or stomach pain, and unexplained hemorrhage. Symptoms may appear anywhere from 2 to 21 days after exposure to Ebola, but most commonly, the average is 8 to 10 days.
It spread through broken skin or mucous membranes, for example, the eyes, nose, mouth. Objects like needles and syringes that have been infected with Ebola can also be used to transmit the disease, and also consumption of primates or bats. Contrary to popular belief, transmission of Ebola is not airborne or cannot be spread through food.
Healthcare workers and the family members who are taking care of symptomatic Ebola patient without proper protective equipment are at high risk, especially if they come in contact with the blood and body fluids through the broken skin. There is some risk in case you are using proper PPEs but working with the symptomatic patient within 3 feet. There is low risk in case you are traveling with the patient or staying with the patient in a same room. In case you have been in a country with the Ebola outbreaks within past 21 days, there is a low risk. But in case you are touching a symptomatic patient or you are working with the asymptomatic patient, there is no identifiable risk.
If a patient shows signs and symptoms and has high-risk exposure to Ebola, then the definitive diagnosis is by the isolation of the virus by tissue culture, reverse transcriptase polymerase chain reaction, enzyme-linked immunosorbent assay within few days. Later in the disease, isolation of IgM or IgG antibodies could confirm the diagnosis.
There is currently no FDA-approved vaccine or antiviral drug for the Ebola virus. Treatment of symptoms is the main course of treatment of the Ebola virus, and also treatment of complications of the disease. This includes replacement of fluids via IV fluids and IV electrolytes to maintain an electrolyte balance. It also includes replacement of oxygen and maintenance of blood pressure, as well as treating coexisting infections that may occur during the infectious process. We must allow the body to develop natural antibodies to fight the virus. This means that younger people and more immunocompetent people are more likely to survive the disease. Experimental antivirals and use of blood transfusions from survivors have also been tested but have not yet been proven scientifically valid.
To prevent contracting Ebola, you need to make sure that if you're going to an area that has Ebola, or if you live in an area with Ebola, that you practice good hygiene. This includes washing your hands and using hand sanitizer. To prevent contracting Ebola, if you are in an area that has Ebola, or if you are traveling to an area, make sure you practice good hygiene. This includes washing your hands and using hand sanitizer. Do not handle items that have been in contact with anybody that has Ebola, including blood and bodily fluids. Make sure you avoid funeral and burials that have someone that had Ebola. Make sure you avoid contact with bats and non-human primates. Make sure you avoid facilities in West Africa that have had patients with Ebola. And when you return from African countries, make sure you monitor your health for 21 days.
Healthcare workers need to remember the 3 I's: identify, isolate, and inform. Identify if your patient has traveled to a country with active Ebola disease or had exposure to someone with Ebola. Isolate them in a private room, preferably with its own bathroom, and adhere to strict isolation protocols. And inform, let your hospital infection control program know you have a patient and your local health department.